A tear of the cartilage within the elbow joint may develop as a result of wear and tear or physical trauma. A surgical procedure to repair cartilage involves removal of the affected region. This keyhole operation involves making small cuts around the joint to insert a camera and instruments. The joint is filled with a saltwater fluid to expand it and create room for the surgeon to operate. Any detached cartilage fragments, known as loose bodies, are removed, and the flap and frayed edges are trimmed and cleared. The fluid is drained at the end of the procedure. The cuts are then closed with sutures. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you've understood everything.